Hello, Kellen. I'm Dr. Reichert.
Hey, nice to meet you.
I'm going to be examining your spine from about the base of your head down about your belt line. If I need to expose any of those areas of skin, is that alright?
Yeah.
Alright, thank you. Let me check this tape. Alright, if you can have a seat facing that way and take off your shirt, please.
Okay.
I'll be examining your ESIS. If you can relax your head, please. Alright. Now if I can have you lay face down. And tuck your shorts a little bit.
Okay.
Now for the sacrum. Hurry up and cross your arms. And come back to extension. Have you rotate with me? Assess the lateral bending. Again. Cross your arms. Okay, I'm going to be assessing your atlas now. If you can close your eyes and move your head forward and backwards and then find a neutral posture in the middle and hold it. Okay. Your nose looks about neutral, so the anterior tubercle of your atlas should be about neutral. If you can sit down, please. Rotate your hands sideways. In the general scan, I assessed the pelvic, lumbar, thoracic, and cervical regions. In the pelvic region, I began with my thenar eminence on the PSIS and pushed medial to lateral and posterior to anterior at a 45-degree angle, feeling for joint play and the in-play assessment. During my scan, I found that the right ilium was restricted and needed further evaluation. In the lumbar and thoracic region, I began with a soft fist and contacted the spinous processes starting at the lumbosacral junction and moved upwards, assessing each segment for joint play and infill. The lumbosacral junction area and T67 segment both needed further evaluation. In this assessment, you still need to follow the angle of the plane of the facets while pushing P to A. In the cervical region, I contact my thumb and my index finger pushing P to A on the articular pillars. And my line of drive is in the angle of the facets. A little more S to I at the base and a little more I to S at the top. The atlas, I contact the lateral masses and push P to A in the same manner. The atlas was seen with a restriction and needs further assessment. In the further assessment of the right ilium, I again contacted the medial aspect of the PSIS and came onto the sacral base while pulling on the ASIS to test posterior glide. Test anterior glide, I lift the leg of the corresponding side and pull it forward, feeling for independent movement of the bones. Lateral and medial glide are assessed by pushing the foot left and right of the body, and I found that the right ilium had a medial glide restriction, or an EX ilium. In further assessment of the sacrum, my segmental contact points are the 6 points about the sacrum, 3 on the base, 3 on the apex. In my assessment, I found that the sacrum had a counter-rotation restriction about the right oblique axis. This is a left AI sacrum. At the L5-S1 level, I contacted the lateral aspect of the L5-S1 tubercle. My line of drive is P to A, and in this I am assessing rotation and lateral bending to see if the joints move independently. My findings were there were no restrictions. For the T6-T7 spinal segment, my segmental contact point is found by bisecting the scapula onto the midline to the T7 spinous process, then moving up one spinous process to T6. I test flexion extension first by having the patient bend forward and back to feel the spinous process open up in flexion and close down in extension. Then rotation is assessed by having the patient bend and rotate forward, and you should feel that the spinous processes move independently. Then I assess in play by pressing P to A, press lateral to medial to see if it springs me out or if it's restricted. In lateral bending, have them to their side and press lateral to medial and slightly S to I. For this segment, I did not find any restrictions. The ribs corresponding to this segment are then found by going 2 interspinous spaces up and then out laterally 2 inches to the intercostal space. I assess elevation and depression. Elevation by having the patient flex forward, slightly rotate, and I can assess infill of the rib by pressing inferior to superior, feeling for elevation. Then for depression, I have them extend backwards and feel the intercostal space close down. I can go above and contact the top of the rib and then test depression of the rib by springing slightly S to I. There were no restrictions found at this level. The atlas assessment, you have the patient flex and extend their head with their eyes closed, their feet shoulder width apart, until they find a neutral position and stop. Then you examine the height of the elevation of their nose to determine whether it's superior, neutral, or inferior. My patient's was neutral. You need to stay close enough to the patient so that in case they lose their balance due to proprioception being decreased with your eyes closed, just to make sure for safety precautions. In further assessment of the atlas, I contacted the lateral aspects of the TVPs of the atlas and then pushed lateral to medial on each side to feel the lateral glide or translation. For rotation, I have the patient rotate their head and then feel for joint play, then spring the last eighth of an inch once in pretension to feel for end play, P to A. My findings were that the anterior tubercle was neutral, and it had a left to right translation restriction with a right rotation restriction. This is an A-LP atlas.